Elder Abuse Network. Morgan.
Thank you. So I hope everybody can hear me, and please let me know if you can. My name is Morgan D.E.A.N, and I am the Community Support Specialist with the region of Durham. Okay, and I am here to represent the Durham Elder Abuse Network, which is also known as D.E.A.N. I just want to first start off by thanking the 100 women who care Durham region for inviting me to speak tonight on the network's behalf. To start off, I'm going to do a brief overview of what D.E.A.N is. I know some of you may already be aware, but for folks who aren't aware, we have been in existence since the early 90s, starting with professionals in the long-term care system. We quickly expanded to include other agencies and services outside that included community agencies that supported not just long-term care residents, but also retirement residents as well as the community. Today, the network is comprised of around 80 dedicated agencies representing the healthcare sector, social services, justice, mental health, and housing sectors, etc. We work alongside our desks as members to share information and resources to break down barriers and reduce gaps in services. We all share the D.E.A.N mission of improving the lives of seniors in Durham region, using the strength of cross-sector expertise and working together in collaboration. The work we accomplish within our network is supported by fundraising and donations, as we have no core funding. With donations, we have been able to do great things in our community, including raising awareness of the issue of abuse and neglect, and also directly supporting victims of abuse and seniors in need. The funds used under the network are only accessed after all other support options are exhausted, which brings me to my next point. We get things done. In the past, dollars donated to D.E.A.N have enabled seniors who are evicted or discharged from hospital with no place to go access safe accommodations until long-term solutions could be found. For example, Jennifer Josephson, the chair of our network, has spoken in the past about a senior who was supported through D.E.A.N. This person had nowhere to go, no family support, so D.E.A.N supported the cost for this person to access residents through a local long-term care home, later to the Bethesda House, and currently in permanent housing. We continue as case managers to provide wraparound support services to ensure this person is supported in the community. The funds also have provided people access to basic needs, including food. For example, the emergency meal program in partnership with Community Care Durham and senior centers across Durham. D.E.A.N members and others can request up to 14 days of emergency meals for seniors in need. More recently, we have seen a huge increase in access to this program as food insecurity amongst our aging population increases. In my experience, this trend has largely been a result of many seniors struggling to access accessible and affordable transportation and due to a lack of grocery shop services in our community. The funds also go towards things like paying for clothing, paying for furniture, moving expenses, paying for transportation for folks who may require urgent medical assistance, pay for storage so folks don't lose their belongings, pay for bills until the Office of Public Guardian and Trustee have the authorization to make financial decisions, purchase medical equipment, and I could go on and on and on. The last example I'd like to highlight is one of the most vulnerable cases I have managed while working in my role. The concern started at the beginning of 2023 and was brought to my attention in May of 2023 after support services had exhausted all options to care for this individual living in the community. This person was wrongly removed from long-term care, and despite the extensive list of health and safety concerns, the caregiver, who was also the substitute decision maker, refused to allow this person to return to long-term care. Due to the senior's lack of income and no other support options, D.E.A.N covered the cost of the capacity assessment, which allowed the Office of Public Guardian and Home and Community Care to come in and make the critical financial and personal care decisions that were needed to keep this person safe. Between D.E.A.N, many community partners, and extensive hours of case planning, we were able to ensure this senior was no longer at risk of abuse, and was safely housed in long-term care with no risk to be removed or returned to community. Overall, I thank you for your time and thank you for listening to a quick summary of the incredible work that we do to support the vulnerable population. D.E.A.N hopes to be the recipient of this amazing donation to continue the wonderful work we do for seniors in our Durham community. Thank you so much.